In this video, we are going to discuss the very important management of hypoglycaemia, or a hypo. When your blood sugar decreases to below normal levels, which is a blood glucose level less than 4 millimoles per litre, this is called hypoglycaemia, or a hypo. Hypos can occur for a number of reasons, including too much insulin and not enough food, or food has been delayed, or a meal was missed. You may have undertaken some unexpected exercise or exertion. Alcohol is another potential cause, along with previous hypos, which may put you at risk of another hypo.
The first time I had a hypo was I think I was about 7. I didn't really understand what was going on, and I remember having tingles in my hands and my vision went a bit blurry. It was really frightening.
Different individuals can experience a variety of symptoms. Some can be more extreme than others. It's important to be aware of the symptoms so you can recognise them and put procedures in place to deal with them.
The first time I had a hypo, it was very stressful. I was very anxious. I started to break out into a sweat. I started trembling and shaking. So straight away I sat down to check my blood glucose level and could see that it was getting very low. Luckily, my practitioner and dietitian was very helpful and prepared me. I had some jelly beans and waited for about 15 minutes, and then I retested myself. When it started to rise, I knew I could then have a piece of fruit and just monitor. It's very important that you have that knowledge and to stick to your routine to keep it under control, can be aware of your body and what's happening to it.
It's important to treat hypos promptly, as soon as the symptoms arise. If you're experiencing the symptoms of a hypo, test yourself if it's possible. But if you don't have a test available, then treat it straight away with 15 grams of a fast-acting carbohydrate. This can be foods like up to 9 small jelly beans or 1/3 of a cup of Lucozade soft drink or fruit juice. Or you can purchase sachets of glucose gel which contain 15 grams of carbohydrate. If you are driving, pull over safely to the side of the road as soon as possible. Turn the engine off and treat with 15 grams of fast-acting carbohydrate. You'll then need to wait 10 to 15 minutes. This is the hard part, but you can't absorb faster than 1 gram per minute, so waiting and testing again stops you from over-treating and going too high. When you test again, if you're still under 4 millimoles per litre, then repeat steps 2 and 3 and take another 15 grams of fast-acting carbohydrate. If you're over 4 millimoles per litre, have some longer-acting carbohydrates. If it's mealtime, have your meal, but if it's more than 20 minutes to your next meal, have 15 grams of slow-acting carbohydrate. If you have frequent hypos and delay treatment, you may begin to lose symptoms. It might sound nice to not experience tingling, shaking and headaches, but it is not good to lose those early warning signs. Loss of early warning signs is called hypo-unawareness. People with hypo-unawareness still get hypos. They just lose the ability to recognise and therefore treat it before the psychological or cognitive symptoms and subsequent neurological symptoms can occur.
I think the best way to sort of handle it is to understand what it is that's happening and understand your condition. I guess it's kind of just like having any medical condition. You just sort of really need to understand what it is that you've got and how to deal with it.
Occasionally, someone may have a severe hypo which requires assistance from another person. This occurs if they don't have sufficient levels of consciousness to treat themselves. First aid treatment for someone in hypo who can't take oral treatment is glucagon injection given by someone else who has learned how to use it. Most people living with diabetes will experience minor hypoglycaemia and manage self-treatment without any problems. The key is knowing the symptoms, paying attention to them, carrying treatment with you, preferably a pre-prepared hypo kit, so that the hypo can be treated without over-treating.